I'm Clinton Thurber. I'm an electrophysiologist at Kootenai Health. At Kootenai Heart Clinics, we have a number of ways that we can treat abnormal heart rhythms, including things like ablation, a pacemaker when indicated, or a defibrillator when that's important too. So a unifying thing for all of these treatments, ablation, pacemaker, defibrillators, is that it buys patients quality of life and freedom to feel that they can do what they want. So many times these arrhythmias are so debilitating they can't get out and enjoy a hike with their family or travel to see a relative across the country without being nervous that something's going to crop up all the time. And so the goal with a lot of these treatments is to really restore quality of life. Everyone has an individual story and an individual set of circumstances. So the important aspect of incorporating all of that context that's unique to the patient into our decision-making process is that not everybody's the same. People have different goals, people have different hobbies that they want to pursue or things they want to do with their life. And all of that has to be taken into context when we decide how to treat arrhythmias of the heart. There was a patient I saw soon after I started working here who had arrhythmias for a very long time, and she was quite young and debilitated from this. Sometimes her heart rate would go as high as 200 beats a minute. And she had some family members too, young family members that she was caring for, and really needed to straighten out her own health and situation. And she'd sought care in other places and out of state. Unfortunately had a recurrence and came in to see us about it. And from an arrhythmia standpoint, had multiple circuits, very interesting physiology. It was a long and complex procedure that we ended up doing. But the feeling of seeing this patient back in the office 3 months later, free of arrhythmias and able to care for her family in the way that she always wanted to, was quite rewarding. My training was at Harvard in Boston, Massachusetts. One of our new colleagues came from Stanford in Northern California. One great thing about Kootenai Heart Clinics is the collegiality among all the various team members, physicians, staff, nurses, techs, schedulers. Everybody seems to work really well together. Everyone is kind and compassionate towards one another and works in a professional way. I think this extends to patient care too. All of these folks, to some extent, interact with patients. And, it's one after the other during a patient visit, hopefully puts together a whole picture of kindness and is true to our value system as an institution. Our goal when patients leave, whether it's just a clinic visit with us or after a procedure, is that they leave feeling like they've been part of our family and have received the best care they could have achieved.